We're going to talk about pimping. And it sounds terrible, but pimping in medical school is when a senior doctor asks rapid fire questions to someone that is their junior. Sometimes this can be used as a valuable teaching tool to gauge residents' and students' ability to think through clinical situations. For example, if you're on rounds and you have a patient who had a stroke, you might ask about Chad's 2VAS score to gauge their ability to assess risk factors for strokes in the future in someone with AFib. If this is done in a collaborative manner where the questions are appropriately tailored to the educational level, this can be valuable and I don't have a problem with it. But some attendings are not as collaborative in their process and use pimping as an ego trip to ask students questions that are well outside of their knowledge base. And sure, some people might need a kick in the pants to be reminded that they have to study for medicine. But many of us aren't in that boat. A lot of us want to be there and we want to learn, but it's very difficult to do that when you're shamed if you get an answer wrong. And I'm not saying there isn't a time to be harsh with your residents and your med students, but it should not be the default. And I find that if you can pimp in a more collaborative way that supports learning and allows students to be constructively given feedback instead of yelled at or kicked out of the OR for not knowing something, I think we're going to have better success in producing empathetic doctors and making for more curious medical students. So, what do you think? Do you think pimping is beneficial? Do you think that we should change it in the future? Do you think the current system is working? I'd like to hear your thoughts.